So this year at GI ASCO 2022, we had the opportunity to present data from Flatiron about real-world immunotherapy biomarker testing patterns and results for patients with advanced gastroesophageal cancers. As I mentioned earlier, we used the Flatiron database to perform this analysis. We had some key eligibility criteria based on which we selected the patients from this database. Patients had to be greater than 18 years of age at the time of diagnosis of advanced G-junction cancer. They had to have 3 or more months of follow-up from the start of first-line therapy and did not receive any form of blinded clinical study drug, and these patients were included. Based on the eligibility criteria, we had initially picked out a sample of almost 2,000 patients, but after excluding patients based on eligibility criteria, our sample size boiled down to about 1,142 patients. Now, these analyses are presented only for purely the MMR and the PD-L1 testing, again, both in adenocarcinomas and squamous cell carcinomas. What's important to note is that at the start of first-line treatment, not all patients were tested for PD-L1 and not all patients were tested for MMR/MSI. We did show some graphs in our poster which showed that our testing patterns had improved over time over the years from 2017 to 2020. We just hope that with the approval of immunotherapy drugs in the forefront and listening to all the data that has been presented at the various congresses over the past year, we are now beginning to understand that the addition of immunotherapy is most favorable in a certain subgroup of patients selected by their PD-L1 score. And it would be interesting to see how this would pan out in the future years as how our testing patterns improve. There are some limitations to the study. There was a lot of missing data due to lack of documentation. Again, a lot of treatment regimens could not be accurately determined. And as I just mentioned, the study period predated the approval of the immunotherapy drugs in the first-line setting. So that would be an important thing to kind of compare and contrast over the next few years as to how we do with testing patterns.